and in succession to the videos what I have been taking up in pharmacology. So today's video of this will be discussing about a very important and a short note in the professional exams. They can ask you about what are purgatives and what are laxatives. So in this video, I'll be discussing in a very brief gist the minute and a very subtle difference exists between purgatives and laxatives. So starting with purgatives. So these are the substances which cause intestinal evacuations. Now, there are certain conditions where the intestinal evacuations becomes very important. Why? Because there are certain patients who needs to be prepared for any kind of a surgery, or if there are certain helminths, anti-helminths drugs are given, and there are certain worms in the intestine which needs to be evacuated, or any kind of their eggs are there. So these for preparing the patients for any kind of a surgery, for colonoscopy, or any kind of a colonoscopy, it is there for rectum examination. So in such conditions, what it is done is that the evacuation of the intestines is very important. So what is done is that there is administration of certain purgatives and laxatives are given to such patients. And there are certain patients who are suffering from chronic constipation. So the patients who are suffering from chronic constipation, the patients who are having a very difficulty in passing stools, that is, they have to strain a lot to remove the stools out of their body. So in such conditions, the doctors are going to prescribe these purgatives and laxatives. So there are very many important indications for the use of laxatives and purgatives. Firstly, the patients who are having difficulty in passage of stools. Next, in preparing the patients for any kind of a surgery such as colonoscopy, or in patients who require that is, their anti-helminthic drugs have been administered to them, and for the evacuation of the intestines, this is very importantly needed. The patients who are having a difficulty in passing stools, that is, they have to strain their intestines so much. So these drugs becomes the choice. These purgatives and laxatives are the drugs of choice for such patients. So purgatives are those substances which cause the intestinal evacuations, and they are divided according to their nature into three types. First, it is the laxatives, and they can be broader subdivided into the hydrogogs purgatives and the cholagogues purgatives. So these hydrogogue purgatives, they act with great energy. So they act with great energy, and they not only increase the glandular secretion, but they cause a very abundant outward effusion, so that the dejection which they produce are extremely watery. So the word itself is suggesting that they are called as hydragogues. Since they are hydragogues, they are going to expel the excess of water, and the secretions what they are going to expel, these are extremely watery secretions what are being expelled. So these hydragogue purgatives, they also excite very rapidly, and they induce violent peristaltic motions. So you must be very well aware that in the small intestine of us, the proximal part, it is called as the duodenum. In the middle, it is the jejunum, and the ileum is there. So what are the peristaltic motions? So these peristaltic motions, these are regular rhythmic contractions what are proceeding in a wave-like manner in these intestines to get rid of the excess of fecal matter. So these fecal matters, the hydrogogue purgatives, they are going to have a very violent and a rapid action, and they induce the rapid and violent peristaltic motion, and thus evacuation is mostly, it is extremely watery evacuation what the hydrogogue purgatives do. Next, we have the cholagogue. That is, the cholagogue purgatives are those which remove the bile from the body. However, there are some drugs which remove the bile by stimulating the secretion from the liver. So in such a condition, there are certain drugs which are going to stimulate the liver to secrete excess of bile. So if the purgative action is not there, so such drugs, they are called as the hepatic stimulants. So hepatic stimulants and cholagogue purgatives, these are two different entities. Cholagogue purgatives, they are going to remove the excess of bile from the body, and they are going to cause the expulsion of the bile from the gallbladder. So after secretion from the liver, the bile is stored transiently in the gallbladder. So these cholagogue purgatives, they are going to remove the bile from the body. They are going to expel the bile from the body. But the hepatic stimulants are those drugs what are going to cause the removal of the bile by stimulating the secretion from the liver. So if the purgative action is not there, they are called as hepatic stimulants, and these cholagogue purgatives, they act by quickening the peristaltic action of the duodenum. So this is the schematic diagram what I have drawn, that this is the small intestine, the duodenum, the middle part is the jejunum, and the terminal part, it is called as the ileum. So what the cholagogue purgatives do, these cholagogue purgatives, they act by quickening the peristaltic action of the duodenum. So the peristaltic action of the duodenum is increased, and thereby this is going to lead into the prevention of the absorption of the secreted bile. So the prevention, the secretion, the bile what are being secreted, they are not being absorbed into the body. Okay, now next we have another class of drugs. What apart from this purgatives, there are certain class of drugs what are called as laxatives. So these laxatives, they are going to increase the action of the bowels only slightly. So do remember, students and viewers, the purgatives, they are going to have a fast and a rapid and a violent action, whereas the laxatives, their action on the bowels, their action on the intestines, they are slight, they are very soft actions of there, and they render the motion slightly more frequent, and these laxatives have a milder action. So do remember, students and viewers, the laxatives are going to have a milder action on the bowel movement, whereas the purgatives are going to have a strong and violent action on the intestines or the bowels. So these laxatives are going to have a milder action, and they render the motions slightly more frequent and softer without causing any irritation. All right, and thus the elimination of soft but formed stools are formed. So do remember, students and viewers, that in case of purgatives, the secretion what is expelled, it is mostly of a liquid nature, or it is mostly the purgative is a stronger action is there, and more fluid evacuation is there in case of a purgative. But in case of a laxative, the evacuation what is there, it is more of a softer and formed stools are being evacuated. So do remember, if purgatives are there, that is evacuating more of the fluid evacuation is there. But in case of laxative, the soft stools are being evacuated, that it is more of a solid or a semi-solid type in case of a laxative. So do remember, students and viewers, I would like to emphasize one more thing, that there are different classes of drugs what have the purgative and the laxative actions, but on a general, on a common basis, what is found is that whatever drugs they fall into this category, if low doses, they are being used in a low dose, they act as laxative, and if they are used in larger doses, the same drug will act as a purgative. So do remember, students, this was a very short discussion where I've tried my level best to give you in simple terms that's to what are purgatives and what are laxatives, and what are the striking, distinguishing, differentiating features what segregate the laxatives from the purgatives. So if you still have any queries or comments, you're most welcome to comment me in the comment section. And students and viewers who are new to my channel, who haven't subscribed, subscribe, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.